Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about how to prevent cybersecurity threats in your medical practice. Medical practices are one of the prime places that cyber criminals like to target. And today we're going to review why they target medical practices and what can happen if you were to have a cybersecurity issue. You're probably asking yourself, why are healthcare offices and records so sought after by these criminals? Well, there's a few reasons. The first one is the protected health information and the protected personal information that we have on patients in our systems is very sensitive, and it provides a lot of information for these criminals to be able to do further bad things. Think about it. We have full legal names. We have dates of birth. Sometimes we have their social security numbers. We have copies of driver's licenses. We have information on their health insurance, their relatives, their diagnoses, their drugs. I mean, there's so much information. You can almost take over someone's identity with the information that's housed in medical records. Also, medical services have grown significantly in technology with the use of electronic platforms such as electronic medical records, remote access, we have telehealth. And so with those technologies comes vulnerabilities because of the nature of how it's all stored. And a lot of practices, especially smaller practices that are not big conglomerates, don't usually have a full-time IT security person or agency working constantly to identify threats, to get rid of the threats, things like that. I made a list of some of the most common threats that we can see in healthcare because this is something that you need to be made aware of, and you need to make your staff aware of it as well. So the number one is phishing attacks, and that's phishing. And these are fake emails with links in them that if someone clicks on them, it can put a virus on the computer, a worm, without you even knowing it. It can also provide access to those criminals without you even realizing it. It's really important that staff is trained to be able to identify what could be a fake email, reporting it to the appropriate places like your IT department or a manager if they were to see something, and not click on the links as well. We also have ransomware. I'm not sure if you are familiar with, about February of 2024, so almost 2 years ago, Optum had a huge cyber attack, and the rumors are, I don't know if it's confirmed or not, that there was a ransomware that was put out there. And a ransomware is where the hackers will lock the files until a certain ransom is paid. And that's not good either because it shuts down everything. They have access to things they shouldn't, and it just causes a ton of chaos and downstream repercussions. Then you have the exposure vulnerabilities by staff and even yourself using weak passwords or sharing their credentials for logging on to different places, which is a huge no-no, including insurance portals, CMS, logging on to their computer workstations, anywhere where someone has an individual username and password. The password should be, I think now they're saying at least 15 characters long. It used to be 12. I think they've increased it to 15 or 16 if you stay on top of those requirements. And it's a combination of capital letters, lowercase letters, special characters, numbers, and it can't be in sequences. It can't be certain formal names or titles, things like that, because of the way it makes it easier for these cyber criminals to guess the passwords. And then again, if they have usernames or passwords for an individual user, they should not be giving those to other people at all, no matter what. They should be secure. They shouldn't be written down and easily accessible, things like that. And then lastly, a lot of people don't realize if they're on an unsecure Wi-Fi, there's not the proper security protocols put into place for the Wi-Fi connections that they're actually accessing the medical records on, that it can be a vulnerability and using outdated software. So if you don't have a regularly hired security person that is going in and ensuring that your staff is updating all of their software, that they're changing passwords regularly, identifying any threats that could be coming in, you're putting yourself at a high risk exposure for being hacked. A huge suggestion that I have to prevent this is to strengthen your staff training and awareness in your office. I know I touched on that a little bit previously, but I can't stress to you enough, because of all the changes and the new capabilities that these hackers are finding, that you keep your staff in the know, you keep yourself in the know, you use common sense, which I know can be difficult, but some ways that you can train your staff. I wrote down some notes. You can conduct short monthly trainings. Don't just do it once a year. They need regular reminders, I promise you, but you can keep them short if you're doing them frequently. You can teach staff how to identify a suspicious email. That's really important. Looking at the addresses they're coming from. A lot of times it might look familiar, but if they look really close, it's missing a certain letter. So it's not the true address, or the name of the person is spelled incorrectly or something like that. Or maybe it's not a .com, it's a .net or a .org, and that can give it away. You want to teach them to never click on unknown links or attachments. So it's not just the links in the emails, but if the emails come with attachments, they shouldn't be opening those if they're not truly 100% sure of where it came from. It's always better to err on the side of caution. And you should be requiring verifying calls or emails when sending patient information. Personally, I highly recommend to avoid sending patient information via email if at all possible. Try to use your EMR messaging system to the portals or via the portals if available to your patients, but really try to reduce any kind of written electronic communication directly to patients if it's through just a regular email or through a text message, unless you're using a platform that is HIPAA certified and regularly monitored and checking all the boxes that it is fitting and hitting all of the required criteria to be able to transmit that PPI and HPI. Okay. If you weren't expecting it, don't open it. And I know that's hard in some of our roles as a manager. Sometimes you receive things that you aren't expecting, or a lot of times. But you have to use your critical thinking skills. And again, erring on the side of caution. Let's see here. Some phishing test tools that they recommend is KNOW, K-N-O-W, capital B-E, 4, the number 4. It's a paid service, but I guess it works really well. So that's something you can look into, or other things similar to that service. And then there's a Google phishing quiz. It's for free, and you could maybe give that to your staff to see how well they do. There's different resources out there because this is a growing concern. You just need to look into it, and you need to implement something and do it regularly. Again, using strong passwords and also adopting multi-factor authentication is going to be key in avoiding hacks and cyber attacks. The passwords that we talked about is that it needs to be long, right? Like I said, I don't remember what the new requirements are, but it's definitely a high number. But you also need it to be a complex thing. So some people recommend using like a phrase or a sentence that you're very familiar with, and just doing like the first letter of each word, something that someone couldn't easily guess. It couldn't be in some kind of algorithm that's easy for a computer to guess, things like that. So you need it long and complex, okay? Phrases are definitely more useful than just putting a name out there or a word with some numbers. And then activating the multi-factor authentication, or MFA, wherever you can. A lot of EMR systems are coming out with that capability because this is such a huge deal. But if you notice, when you log into your bank account or other portals for shopping and stuff, a lot of times they'll either send you a text message with a code, or you'll have to open an email for a code, or they'll call you. It's becoming very common because of the easy vulnerabilities and access that these hackers are finding without it, okay? And then if you're going to be accessing anything remotely on your system, you really should be using a VPN. If you're not familiar with what a VPN is, I would definitely write this down right now and look it up. It is a paid service, but I promise you it is so worth it. I have a VPN through my security provider that I put on all of my devices, and I can activate the VPN when I'm not home. So I am on a secured link if I'm looking up something with sensitive information like a credit card account or my bank account or things like that. You never want to open anything on public Wi-Fi, especially your EMR, your PPI information. HPI is going to be so vulnerable with that. And you also don't want to be opening anything on your phone as well. So now let's talk about secured devices and networks, okay? For computers and tablets, you want to use automatic updates if you can. You can go to settings and tell your computer and your tablets, your phones, that anytime that a new software update comes through, it automatically will update after hours is usually what I set it to. It's just the most convenient so it doesn't start rebooting in the middle of something. I've had that happen, it's horrible. And then you want to make sure that you are requiring all of your devices to have locked screens after like a minute or two of no use. And your staff really should be locking their screens before they even walk away from their desk. So if they're at the front desk, if they're in the back office and they need to go do something or ask a question to someone, they should not just be getting up and leaving their device. They should be locking it so that nobody can see what's on there and nobody can sit down and see what they've been doing. And then you want to use encrypted storage. That's something an IT specialist can help you with. But again, there's HIPAA guidelines on this about the storage and the backup, so make sure that you're following that. For your Wi-Fi, you really should have separate networks in your practice, one that is secure for your staff to use, and then one that's like a public option for your patients to use. They should never be on the same, and you should never give patients the password to access the Wi-Fi that your staff and yourself are using to access the EMR. That is a big no-no. And you want to make sure that you're disabling a guest network auto connection. So they should never be able just to automatically connect. They should have to either put in some password for that guest public network that you keep at the front desk or in your waiting rooms to let them know. But there should never just be an auto connection without having to put something in. Okay, so just another thing to keep in mind. And then again, for remote work, people who are accessing your information from outside the office where it should be a secure network, they really should have a VPN that they're using. And you can do some setups that they wouldn't be able to log into your EMR or other business software unless they're on a secure VPN. That's something you can talk to your IT security person about as well. And then backup and recovery planning, you should be doing daily backups if it's not automatically doing it already. You should store your backups either off-site or have a cloud-based backup system. And you should test your recovery process on a quarterly basis. If you hire an IT person, this should be in your service agreement, and I would check for that and make sure it's being done. And then create a simple if the systems go down kind of procedure SOP so that your clinic keeps operating, but you're not putting yourself at any risk because you're not following or using, I should say, secure passwords, internet, devices, etc. Okay. So while you're doing all of this, you have to make sure you're keeping all of the HIPAA guidelines as well in mind. So you want to make sure that all your server rooms or anywhere that you have your devices and stuff is locked up, including your networking equipment. It shouldn't just be out in the open or easy to access, especially after hours. It should be in a room where it has additional security. You should use privacy screens in patient rooms or where patients can possibly see the screens. So if you're taking your laptop in a room with you, if there's a possibility they could stick their head through the window when they're checking in or out, or somebody's screen is back, even though it's far away, you shouldn't assume. You should have privacy screens on everything where a patient possibly could see the screens. And you must have a clean desk policy. I have a video about that. So if you are not aware of what that means, please check out that video. And you should be auditing your staff regularly, making sure they're following your HIPAA guidelines, protocols, making sure that they're not accessing things they shouldn't, that they're using their own passwords and usernames, and that they only have access to the minimal amount of things that they actually need to do their job. They should not have access to everything or everyone if it's not required to do their job, because that is a huge HIPAA guideline that you should be following, okay? So just as a recap for some of these key things we talked about, make sure you train your staff about all of your internal protocols and when they should and shouldn't be accessing things and using their own username, passwords, clean desk policy, not opening emails that they're not familiar with, clicking on links and attachments in those emails, okay? You want to use strong passwords and multi-factor authentication when able. You want to have secure networks and devices. You need to be backing up things regularly, and you need to maintain physical and HIPAA safeguards. Okay. Again, you're not expected to be the expert on this as the owner, the office manager. Maybe you are, but you're not expected to be. But it is expected that you find someone who is, and you hire them for their expertise in healthcare privacy and security management, that understands the HIPAA guidelines, that knows the risks and vulnerabilities, and can help you prevent that. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And as always, please share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.